And this is Russ. You know, as a knee replacement patient, you probably went in with some hopes that if you did this knee replacement, everything would be good, right? You probably did. Now, if you didn't think that, if you went in there strictly knowing that this is going to hurt like crazy, I'm probably not going to do well with it, yeah, you probably wouldn't have even gone in for the knee replacement. Yeah, you would have been too scared to go in. Okay. So the fact that you went in for the knee replacement tells me that you were probably in enough pain that you just said, that's it, we've got to do this. And I'm hoping that this is going to go well so that I can move on with my life, right? But what do you think is more scary than actually having the knee replacement? I would say it would be the MUA. From the comments that I get from people, from the things that I've read, from my own experience, I think we're all more fearful of the MUA than actually when we went in for the knee replacement. Because we didn't know what we were getting into when we went in for the knee replacement. Then the pain happened, right? Okay, and things weren't going well. So then you weren't bending enough. You didn't have enough flexion. Maybe your extension wasn't good. So the doctor tells you, yeah, you're going to need an MUA. What's an MUA? Manipulation under anesthesia. Okay, so what they're going to do is they're going to put you out, right? Doctor's going to go in there and he's going to bend your knee for you because you can't bend it. So you know how much it hurt when the physical therapist was bending it. So all you can think of now is, how hard is this doctor going to be pushing on me? Am I going to hurt from that? These are the comments that I get, all right? And these are the comments that I read. So I think we're more fearful for the MUA. So here's the question. Why did I go in for a second MUA? Who initiated that? Now, I talked about this before, but I know we got a lot of new people here. So let's talk about it one more time. I went in for 2 MUAs, okay? The second one was because I said, let's go in for a second MUA. So why was it that I wasn't as fearful on the second time around? Because I knew what was going to happen on the first time around because I already went through it, okay? I'm saying that I was just as scared as everybody else going for that first MUA. But by the time we went for the second, I really had no fear. I knew exactly what was going to happen, okay? I even ran into the same nurses and things at the OR. They were surprised to see me a month later back for a second MUA. But I wasn't scared. I knew exactly what was going to happen. And when I brought this up to my doctor, because I wasn't getting the range that I had hoped for after the first MUA, okay? And recently somebody mentioned to me about having to go in for the MUA. Now, I got 130 degrees in the operating room, but I only came back out of there at 90, 91, something like that. So we lost the range, and it didn't go any further than the 90s. So by the time the next month came around, I said, what if we did it again? I knew the doctor could get 130. We already saw that. We have photos of it. Here, I'll show you the photo again. Yeah, if you're new here, you may not have seen this photo, but everyone who's been around here for a while, they've seen this photo so many times, right? That's 130 degrees, all right? And I'll show you the 0 degrees of extension too. So if you think about it, the doctor was able to actually get it there. So we know that the knee is able to bend it, right? We have physical proof. We got photos and everything. How come I can't get it? Why am I stuck at 90? So I figured if we went in a second time, the doctor's probably going to get the 130 again. But if I'm starting out at 90, because I was starting out in the 70s when we went in for the first MUA, then we got to the 90s, right? I figured if we went in a second time, maybe that'll push us into the 110s, okay? So he got another 130 degrees again. But when I got out of there, I was in the 100s. So you don't get what they get in the operating room. And the reason is because he's pushing you to the point of where your knee is capable, but you're stopping yourself when you're awake because now you're feeling the pain. You're not going to let them push it to 130. So if you don't get exactly what the doctor got when he was in the operating room, don't worry too much about it, okay? Because you know that you can get there because he got there, all right? All you have to do is work in physical therapy to let that happen when the pain starts going away, because we know the knee can get that far. Now, of course, scar tissue might grow again, all right? And I think that's probably what happened why I needed the second MUA. Sometimes I wonder if we went in for a third MUA, what would that do? Okay, nobody goes in for 3. At that point, they're going to start thinking revisions and all sorts of stuff. So that's why I went in for 2, is because I wasn't fearful of it. I knew it was going to go on. I just had hopes that it was going to go higher. And of course it did. It went into the low 100s. And then with work, I got it up to 130. Yeah, but I'm not at 130 today, all right? This 130 is when they're pushing hard on you and you're still screaming, okay? That's not reality. Nobody sits there and moves their own leg to 130 and screams, okay? You're going to move it to as far as you can go, and that is 120 for me. I'm happy with that. 120 is what most of the doctors and physical therapists say you need to do for them to release you out of physical therapy. So I'm at 120s today, yeah. So I'm okay with that. But you're talking 19 months now, okay? And I don't hurt when I do that, all right? I just bend as much as I can, take the measurement, I'm 120. The extension is between 2 and 3 degrees from the last time I checked it. It might even be better now. I'm constantly extending my leg. I put it up on my table, on my desk, when I'm at the computer table, and then I just let it rest there. And that of course, naturally just kind of extends it, right? And I've been doing this forever. So, right after the jazz units went away, even when the jazz units were being used for me, for my extension, I would still do that when I wasn't on the jazz units. And so some background for those who didn't know, I was at 10 degrees. The jazz units came in. I got 5 degrees. And then after that, I'm down now to 2 to 3 degrees. So I might even be 1 to 2 degrees. I don't know. I haven't measured it in a while, but it feels pretty good. So anyways, don't fear that MUA. But I understand when you say that you're fearful of it, okay? Because I was scared of it too. And after it was done, I asked for the second one a month later. So anyways, I just wanted to bring that up, give you guys a little bit of encouragement. If you're thinking of an MUA or if the doctor is recommending you to an MUA, it's natural to be scared about it. But after we've gone through it, it's not so bad. Now, let me give you the other side of it too, because I've heard from other patients too that the MUA made it worse. Yeah, made it worse in the sense that they broke the bones because they're pushing hard. Okay, this can happen. All right, so I'm not going to try to tell you that everything is always perfect. Things can happen, but if we play the game of percentages, more often than not, the MUA is going to be helpful, less than hurtful. Now, if your bones are brittle and you have potential issues there that way, I would say get a second opinion and consider that first before you do the MUA. All right, there is always risk in everything. Okay, I don't want to make it sound like you go in for the MUA, everybody gets perfectness out of that, because it doesn't. All right, but everything we do for surgeries or medical things, there's a certain bit of risk. All right, but I would prefer to take that little bit of chance to try to get the range, because I would prefer to be able to bend my leg, bend my knee, rather than not, And I know of people who have given up and just said, there's no way I would do this MUA. It's too much of a risk. I'm going to stay with where I'm at. Okay. Those things happen. I understand. But I always feel sad for that, because I know that if you put a little bit of gamble in there and take a little of trust, maybe you can improve yourself. But yeah, sometimes it doesn't go that well. So anyways, put a downer on the end of this video. Work hard, guys. Don't give up. I've always said that. Don't give up. Keep working at it. Talk to you guys next time.